What is happening, everybody? Guys, today I want to talk a little about, patient assessment. And specifically, I wanted to try to maybe give you a little guidance when it comes to the questions to ask to be focused in your assessment and your questions that you're asking. Everybody go through the check sheets. You go through the ABCs and lung sounds, stuff like that. And that's sort of the hands-on stuff, right? But there's other things that we can talk about that'll help us when we're doing our assessment to keep us focused and also to give the patient a way to express what's going on with them without them totally having to stress out, get confused. Because, keep in mind, this is the first time you've seen that patient. So they don't know you. They don't know what you're going to ask, what you're looking for. So when you are assessing them, asking the right questions, that is going to help you when it comes to getting the information that you need, and also help you and help the patient understand what it is you're looking for and what's the best way that you're going to be able to actually help them. So what I wanted to talk about today specifically is when we're dealing with a respiratory patients that are in respiratory distress or even severe respiratory distress. They can't really speak more than one or two words at a time. When they do, it even makes their shortness of breath even worse. Okay. So when I talk about questions, we're looking for the questions that are sort of yes or no. All right. And this is going to help us learn what's going on with them, getting their medical history, getting what is going on with the present emergency that they're having. All right. And again, this is going to help you build a rapport with them, get them to calm down a little bit, get them to kind of direct you where they're having issues the most, and also to help you, of course, guide your treatment and your decisions, what you're going to do for this patient. So one of the questions you always want to ask, of course, is has it happened before, right? Because a lot of patients that are having shortness of breath, they've got some kind of a condition going on, right? And whatever's happening now, of course, is worse than what they're usually having. All right. So they can have something like, asthma. They can have COPD. They can have even heart failure, right? So asking questions will kind of direct you. So you see them, having these issues. One of the things you can be doing at the same time is sort of looking around the room and looking for clues, right? So that'll kind of help you figure out what it is that might be going on. So let's say you got a young patient, they're sitting next to a nebulizer. So ask them, is it an asthma attack? If you have an older patient that's sitting next to, an ashtray or a cup with cigarette butts in it, okay, is it from COPD? And what about those patients that wake up in the middle of the night, right? They can't breathe, those CHF, those heart failure patients. You see the high blood pressure medications next to them on the table, all right? So if the patients answer yes as to what kind of history they have, then you got your answer. But if they're answering no, then you have to think of other things that might be even more acute, all right? And you have to try to see what those acute causes could be for that age of the patient, what the patient looks like, things like that. Pulmonary, like I just mentioned, CHF, pulmonary edema, things that could be coming from a heart attack, even things like a pulmonary embolism, anaphylaxis, okay, things like that. So another question you can ask, which is very easy yes or no question, is to say if they have they been really, really bad before. One question that I used to ask a lot of patients, especially the asthmatic patients, the COPD patients, was if they've ever been intubated before because of this difficulty breathing. And if they say yes, they've been intubated before, they nod their head yes, then I want to find out, did they feel as bad as they are now when they were intubated? Okay, maybe they've been intubated before, but they didn't feel as bad as they feel at this point in time. Okay, so what the basic thing what you want to do is find out if that happened. That's going to help you sort of anticipate what is going to be going on. All right, anticipate whether or not you're going to need to maybe help them with their breathing at some point, right? Maybe anticipate that maybe they are going to need you to help them, ventilate them with a bag valve mask or something like that. So something else you can find out is if they ever had any treatment that had worked for them before, right? Now, a lot of patients, especially COPD patients, asthma patients, they put off calling 911, right? They're using their own inhalers at home for a long period of time. So the asthma patient you have, they've not gotten any better when they're using their inhaler or the nebulizer over and over again. By the time you got there, you just giving them more albuterol or more nebulizer or combi vent, whatever, is not going to help them. They need more than that at this time, right? They might need steroids. They might need a different type of nebulizer treatment. They might need epinephrine, things like that. So start trying to find out from them if they know what it is that has helped them more in the past. You can ask them, in the past, have steroids helped you? Has epinephrine helped you? Has a CPAP mask helped you, right? And either they can nod their head yes, or they can nod their head no, all right? And this is a way that they are not going to be exerting themselves speaking too much, but you're still, like I said earlier, you're getting your answer. So find out what has helped them before. Again, more Combivent, epinephrine, the CPAP, maybe magnesium sulfate. A lot of patients are very aware of what the type of treatments that actually help them, okay? Now, one thing that I think you want to find out as well is, when did the difficulty breathing that happened, when did it start, right? Did it happen just before they called 911? Did it happen, was it going on for a few days? Things like that. So if the person tells you, let's say that they started having it just before they called 911, if they say no, then try to find out with kind of giving them time they can nod their head yes and no to when it began. Did it start 15 minutes ago, an hour ago, 3 hours ago, 30 minutes ago, whatever it is, and they can nod their head yes or no to let you know how long that it started before they called 911, all right? And also, again, this is going to help you sort of anticipate, if it's been going on for quite a while, that you might be more effective going to assisting the ventilations, going to a CPAP machine, things like CPAP mask, things like that, okay? And again, the same, along with this question, you want to find, did it come on suddenly? Did they wake up in the middle of the night with this, right? Was it just a sudden onset of it, all right? Asthma, a heart attack, anaphylaxis, stuff like that, kind of be more of an acute type cause of them having difficulty breathing, where you get more of a gradual onset, kind of a gradual issue going on. It might be more of a COPD problem, with the COPDs getting worse, or maybe even something like pneumonia might be something that's going on, okay? Mike, I really I like your comments. And Corey, just to break off real quick, I like my shirt. This was a goofy Christmas present somebody got me. So I like to put this on sometimes when I'm doing these videos, just to sort of let you know that I'm not some crazy person over here, at least not in the sense of I'm so married to EMS, I'm just total nerd about the education end of it, that, I like the fun part too, guys. So a couple more questions I think that you can ask. One thing, of course, that I like to ask, I see a lot of people when I coach people and we do like scenarios and stuff like that. One thing a lot of people don't ask is, do you have pain anywhere? Guys, do me a favor, hit that like button too if you're watching this. Let me know that I'm getting some engagement from you, because when you hit the like button too, it keeps this in people's feed a little bit longer, and that helps, get people more access and get a chance to go ahead and see this video too. Because maybe people that ask a lot of questions when they're assessing patients, they're asking too many, not asking enough of the right ones. And this is one that I think is the right question to ask someone who's having difficulty breathing. And that question is, do you have pain anywhere? Now, if they say yes, or they nod their head yes, then you ask where. Can they point where the pain is? All right. Because you want to ask, again, guys, this is all about yes and no questions, nodding their head, yes and no. So when you're asking questions of patients having respiratory distress, let them answer with a nod of their head or yes or no. Okay. And follow up with more yes and no questions. That's going to go ahead and help them as well answer questions. So ask them where the pain is. Let them point to where it is. All right. And then you have to ask the question, is it a sharp pain? Does it feel like a pressure? Does it move anywhere? Does it get worse when you breathe? Does it feel worse when you're breathing? Okay. A patient that has a sharp pain that gets worse with inspiration might be more musculoskeletal in nature, whereas the pressure pain that doesn't change with inspiration, right? That could be more of a cardiac related cause going on. Chest and leg pain with difficulty breathing might be from a pulmonary embolism. All right. So keep this stuff in mind, guys. And of course, it never hurts to go ahead and get that 12-lead EKG if you're a paramedic after managing the airway issue and the respiratory issue. So 2 more quick questions, guys. I want to just cover here real quick. I know this video is a little bit longer than what I normally do. I usually try to keep it under 10, going a little bit longer today because I want to get this out for you because I feel this is really important for you to know. Because again, I feel that we get so wrapped up in the skills end of it and doing the skill sheet and going down that when we get in front of a real patient, it's like we don't know what we're asking, and you're asking about things that have nothing to do with their respiratory problem, or you're asking questions that are making them answer questions that they don't need to answer, and it's going to make them even worse by having to talk too much, right? And with that, one of the questions you want to ask if they're getting tired, right? A lot of patients in respiratory distress can end up decompensating off into respiratory failure because of the effort that they're having to breathe. Even if they're able to get enough oxygen in where their pulse oximetry reading is good, they can still have issues. So a patient that tells you, yeah, they're having problems and they're getting a little tired, it's more than likely they're going to be on the road to needing some assistance with the ventilation. Again, maybe getting that CPAP on them, all right? Because you're going to see patients that are getting tired, they're going to be closing their eyes a lot. They're going to have a hard time holding a nebulizer to their mouth. A lot of times we have to put the nebulizer mask on them, okay? They have a hard time keeping their head up. They're going to be nodding their head a lot, kind of very tired. So get ready, guys. You might have to get that BVM and other airway equipment, depending upon what level you're at. They might need intubation. That might end up having to happen. Okay. Now, if a patient tells you no, they're not feeling tired, all right, and they feel they're getting better, then, that might mean that what you're doing for them is actually working, all right? And then when that happens, guys, when you get to the ER, you're going to want to go ahead and let them know that, all right? Let them know that you found the patient in one way and you've done X, Y, Z, you've asked all these questions, and the patient's telling you that they're nodding their head, they're feeling better. Okay, so again, you want to find out this stuff, guys, because it might actually help them when they get to the emergency room, where the emergency room might not be so aggressive. They might actually intubate the patient if they feel what you've done is helping. They might just continue on more of what the treatment that you've been doing for the patient, and might go ahead and keep that on. All right, guys, one last question, which of course is important, especially if we're going to be giving medications, is to ask them if they have any allergies to medications, okay? Because this is going to help you identify that allergy. You don't want to give them something to make the respiratory issue worse, like put them into kind of anaphylactic issue, all right? So if the patient says yes, that there are medications that they cannot take, obviously they might not be able to speak and tell you what that is. So then it starts being the guessing game again, right? Start asking about different types of antibiotics. Name off amoxicillin, penicillin, stuff like that, Cipro. Find out if they're allergic to that. A lot of people most commonly are allergic to antibiotics more than anything else, okay? And if you can find that out, let the hospital know. Hopefully, if they can't tell you, you can't figure it out, then when you get to the hospital, they can pull the patient's records up and find out what they might have an allergy to. So, guys, like I said, this is either yes or no questions, nodding their head yes, nodding their head no, as a way to get the information you need to start acting on a patient who's having some severe respiratory issues, okay? So keep that stuff in mind. Use the tools that are available to you, the pulse oximetry, the capnography waveforms, things like that that are going to help you have sort of a diagnostic tool to figure out what might be going on with the patient, in addition to what they're telling you, what you're seeing, medications, nebulizers, oxygen tanks, things, ashtrays, things like that around the house. All right. So again, try to make all the questions you ask valuable, make it that it's very focused, and make it so that when you're asking those questions and then yes or no, that you're getting the most data back, right? The most information back from the patient, so that is going to give the patient, again, like I said earlier on, the least amount of speaking they're going to have to do and the effort that they're going to have to make to answer you and to get them the treatment that they need. All right, guys, I hope this all makes some sense. I hope this really helped you. Again, be sure to hit that like button. Let me know that this stuff is valuable. You're getting some use out of this stuff. I really love doing these videos, and I'm trying to find stuff that I can talk about that's a little bit above the norm, not the same old stuff you see all over the place on YouTube and every place else, and kind of focus a little bit more on things that are going to actually help you in your day-to-day EMS career. Okay, I don't want to reteach you stuff your instructor did. Your instructor did a great job with stuff. No sense me reteaching you. I want to kind of augment that for you. I want to make you better at EMS. All right, and guys, one way to do that, if you haven't checked it out yet, go to turbomedic.com and get yourself a membership there. I will see you in the members area there. I actually just looked at a great pediatric respiratory distress video, which kind of motivated me to do this video today. It's about an hour-long presentation on dealing with pediatrics who have respiratory distress. And if you are a member at Turbo, you can just log in, go to the respiratory or the pediatric sections there, and you can get access to that content. If you're not a member, go check it out, guys. It's all waiting for you over at turbomedic.com. All right, I'm going to end it there, guys. Thanks so much for joining me. Thank you for hitting the like button. Be sure that you can share this video, hit the like button, let other people know about it, and be sure, as always, that you stay safe.